Welcome. Today we're diving into the world of heart rhythms to understand a condition called junctional tachycardia. We'll explore what it is, why it happens, how it affects you, and what can be done about it. So, buckle up as we unravel the complexities of this fascinating heart condition. What triggers junctional tachycardia? The causes can vary. Often, it's linked to underlying heart conditions like coronary artery disease, heart failure, or even a previous heart attack. Sometimes, it's a side effect of certain medications, particularly those used to treat heart problems like digoxin. Other culprits include stimulant use, excessive caffeine or alcohol consumption, or even electrolyte imbalances. In some cases, the cause remains a mystery, and we classify it as idiopathic. Now, let's explore what's happening inside the heart during junctional tachycardia. Normally, the heart's rhythm is controlled by the sinoatrial or SA node, which acts as the heart's natural pacemaker. It sends electrical signals that tell the atria to contract, followed by the ventricles. However, in junctional tachycardia, the atrioventricular or AV node, or the tissue surrounding it, takes over as the dominant pacemaker. This AV node is located in the junction between the atria and ventricles. When the AV node fires rapidly, it causes the heart to beat faster than normal. This abnormal firing can either override the SA node's signal or occur independently. The rapid heart rate can reduce the heart's ability to effectively pump blood, leading to various symptoms. Junctional tachycardia isn't as common as other types of arrhythmias. Precise numbers are difficult to obtain, but it tends to affect individuals with pre-existing heart conditions or those who've had heart surgery. It can occur at any age, but it's often observed in older adults. Furthermore, it can be found at younger ages, even in children, often related to congenital heart defects. How does junctional tachycardia manifest itself? Symptoms can range from mild to severe. Many people experience palpitations, a feeling of a rapid, fluttering, or pounding heart. Shortness of breath, dizziness, and lightheadedness are also common. Some may feel chest pain or discomfort. In more severe cases, individuals might experience fainting or even heart failure, particularly if the rapid heart rate persists for an extended period. Diagnosing junctional tachycardia involves a thorough evaluation. The cornerstone of diagnosis is the electrocardiogram or ECG. This test records the electrical activity of the heart and can clearly show the characteristic rapid heart rate and specific patterns associated with junctional tachycardia. Additional tests, such as Holter monitoring, which involves wearing a portable ECG recorder for 24 to 48 hours, or an event monitor, are used to catch intermittent episodes. Doctors also consider a patient's medical history, physical examination findings, and results from blood tests to rule out other potential causes of similar symptoms. Junctional tachycardia is often classified based on the heart rate. Accelerated junctional rhythm is a rate between 60 and 100 beats per minute. Junctional tachycardia has a rate above 100 beats per minute. There are some variations, like non-paroxysmal junctional tachycardia, usually associated with digoxin toxicity, myocardial infarction, or TSOP. Paroxysmal junctional tachycardia is more sudden and episodic. Treatment for junctional tachycardia depends on the severity of symptoms and the underlying cause. For mild cases with infrequent episodes, lifestyle modifications like avoiding stimulants and managing stress may suffice. In more severe cases, medications such as beta blockers or calcium channel blockers can help slow the heart rate. If medication isn't effective, or if the tachycardia is life-threatening, a procedure called catheter ablation might be considered. This involves using radiofrequency energy to destroy the abnormal tissue in the AV node that's causing the rapid heart rate. In emergency situations, intravenous medications or synchronized cardioversion may be required to restore a normal heart rhythm. Preventing junctional tachycardia primarily involves managing risk factors and underlying heart conditions. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking and excessive alcohol consumption, is crucial. Controlling high blood pressure, high cholesterol, and diabetes can also significantly reduce the risk. Working closely with your healthcare provider to manage any existing heart conditions and to review medications that could potentially trigger arrhythmias is essential. The prognosis for individuals with junctional tachycardia varies greatly depending on the underlying cause and the presence of other heart conditions. For those with mild symptoms and no underlying heart disease, the prognosis is generally good. However, for individuals with severe symptoms or significant heart disease, the prognosis may be less favorable. Recent research has focused on refining catheter ablation techniques to improve success rates and minimize complications. Additionally, studies are exploring new medications to better control heart rate and prevent recurrence. Emerging research in genetic factors is also being explored.